First on Fox tonight, the United States hit a big milestone. The Biden administration says 70% of adults have received at least one dose of the COVID-19 vaccine.
Yeah, according to the White House, the 7-day average of newly vaccinated people is at its highest since July 4th.
Meanwhile, here in Oregon, we've been seeing a rise in cases over the past few weeks. From Friday through Sunday, the Oregon Health Authority reported 2,056 cases. Again, that is over a 3-day period. The OHA also reported 5 new deaths. Because of the rising cases, some hospitals across our area say they're in the midst of a crisis.
And all new tonight, Fox 12's Bridget Chavez takes us inside a local emergency department and explains why caring for patients is getting tougher.
We're at the Skyline Health Emergency Department, and it's not that they don't have the physical space for patients, it's that they don't have the staff for these beds to be usable, and this problem isn't just happening here.
We have a staffing shortage where we have a limited capacity on how many patients we can admit to the hospital, and then the transfer crisis is actually more of the issue, where we are a critical access hospital and we can take care of people to the maximum of our abilities. And then once they need to be transferred for something that's more serious, like a trauma, heart attack, a stroke, or something like that, or even intensive care, then we have to find beds at other facilities with higher acuity.
Jenna Newcomb is a physician's assistant and says because the shortage is happening across the region, it's having a ripple effect.
It is definitely a challenge. I have had to call over 10 facilities in the region to try to find a place to transfer a patient that needed a subspecialty in addition to a bed. And then I also had to call eight places when I needed to transfer somebody for a critical care bed.
Newcomb tells me this problem is different than what they were dealing with earlier on in the pandemic.
Right now it's a combination where COVID cases are increasing, and now there's a staffing shortage, so there might be some physical space available, but there isn't enough staff to cover those beds.
She says she's worried about what will happen if cases continue to spike.
As we come into fall and winter and we don't have beds in the summertime, what's going to happen when we do get a surge in cases in the fall and winter?
But the one thing she says we can all do:
get your vaccine, and for the people who haven't gotten it, talk to your healthcare providers and we can talk to you about more.
The biggest message from the ED staff here is, again, if you have not gotten your COVID-19 vaccine, do so as soon as possible. In White Salmon, Bridget Chavez, Fox 12 Oregon.